Committee will come to order, and the chair recognizes himself for an opening statement. This committee has worked to advance three primary goals of promoting job creation and economic growth, transforming Washington and create a smaller, modernized government for the innovation era, and protecting families, communities, and civic initiatives. We've enjoyed great bipartisan success with over 60 bills through the House, over 15 public laws. Just this week, 3 more bills passed the House. 2 of our bills are currently awaiting the President's signature as well. But our work's not done, and with this markup, we build upon our record of results as we consider 7 bills. First, take up 3 bipartisan telecommunication bills. The Anti-Spoofing Act, authored by Reps. Ming, Barton, and Lance, extends existing truth and caller ID laws to apply to text messages in addition to voice calls. This act protects consumers by preventing bad actors from masking their identity as a means to gather sensitive personal information. The E-Label Act, sponsored by Reps. Latta and Welch, is a bipartisan, bicameral effort to streamline government regs by embracing modern technology. The bill allows manufacturers to use digital labels for smartphones and other devices with screens instead of the traditional etched labeling that is currently mandated. Consumers still are able to access important FCC certification information, but manufacturers are able to take advantage of the technology inherent to their equipment, saving money, creating a more visually pleasing device. Finally, the Kelsey Smith Act, authored by Reps. Yoder and Pompeo, will enable law enforcement to use cell phone location data as a life-saving tool in times of serious emergencies. This bill allows service providers to hand over this data when requested by an officer without fear of liability, a measure that could help prevent tragic outcomes by helping locate users in real danger. Next, we'll consider a slate of health bills. For years, President Obama said, if you like your health care plan, you can keep it. And as millions of Americans lost their individual coverage last year, the administration insisted it was only 5%. Those who purchased health care on the individual market who would lose their coverage. The Employee Health Care Protection Act, authored by Dr. Cassidy, would help American workers trying to keep their health care coverage and would offer better choices to small businesses struggling to find affordable choices under the law. The Tick-borne Disease Research Accountability and Transparency Act of 2014, authored by Mr. Gibson, is a critically important bill to address the growing threat of Lyme disease. This bill is going to establish a working group at the Department of HHS that would prepare a report summarizing federal activities related to Lyme disease, identifying the latest scientific advances, and making recommendations to the Secretary and to the Congress. The report would also inform HHS on the development of a strategic plan that would improve prevention, diagnosis, and treatment of Lyme disease. We'll next consider a bill introduced by Representative Jenkins that would provide more certainty to the patients and providers in rural communities. The bill has already been approved by unanimous consent in the Senate. It would help ensure that patients, including Medicare patients across the country, particularly in rural communities, have access to the health care that they need. And finally, we'll consider H.R. 5214, championed by Reps. Olson and Sessions, requiring the HHS to publish specific recommendations for the development of clinical data registries, a tool that we have learned through the committee's efforts to replace the broken SGR formula that indeed will hold great promise. However, we believe that HHS needs to work more collaboratively with interested parties on how to facilitate successful registries. Therefore, this legislation would encourage the development and dissemination of best practices designed to support registry development that works for patients, provider groups, and other stakeholders. I want to thank all of our members and staff on both sides of the aisle for their work. Together, we're making a difference, that is for sure, and I'll recognize Mr. Waxman for 5 minutes for an opening statement.
Thank you, Mr. Chairman. Before I discuss the merits of the 7 bills before us, I want to make a few comments on the process. Last week, Chairman Upton and Subcommittee Chairman Walden issued a press release complaining that the Federal Communications Commission was using an, quote, irregular process, end quote. I disagree with the chairman's assessment, but the title of the release left an impression on me. It read, quote, the process is clearly broken and something smells rotten on the 8th floor, end quote. The chairman stated, again quoting, process rules are in place for a reason. Instead, a troubling pattern of process neglect is emerging, leaving a commission that too often shrouds its work in secrecy and takes shortcuts to impose its desired policies, end quote. Well, by their standards, something is broken in our committee room today. Of the bills we are considering, only one has been through regular order. Some are being considered with no subcommittee markup, others with no hearings. Before we point fingers elsewhere, we must strive to ensure that we operate in an open, transparent manner ourselves. One lesson I learned long ago from John Dingell is that bad process can produce bad results, and that's certainly the case before us today. H.R. 4701 would create a new working group to review efforts on Lyme disease and other tick-borne diseases within HHS. I support efforts to advance research and public input in this area and believe the bill we passed in subcommittee met those goals. But today, we are presented with a new draft of this legislation. We need to ensure that this version would not politicize federal activities on Lyme disease or jeopardize the ability of HHS to make decisions supported by a strong scientific evidence. H.R. 5214, dealing with registries, appears to be solving a problem that does not exist. Robust public-private collaboration is underway to develop and maintain registries, including at the American Medical Association and at the Agency for Healthcare Quality Research. The issue is lack of funding, not lack of guidance. H.R. 4067 would suspend enforcement of the current Medicare rules relating to physician supervision of staff in rural and critical access hospitals. Medicare beneficiaries should be guaranteed a facility meeting some basic standards for having supervisory physicians available if an emergency arises. And that is all the rule requires. Yet this rule would be suspended. H.R. 3522 would allow any group health insurance plan on the market in 2013 to continue to be sold in perpetuity. This legislation would weaken key ACA consumer protections for workers and small businesses. It is bad policy. Two of the three communications bills, the Anti-Spoofing Act of 2013 and the E-Label Act, are common sense. So while they were not voted on in subcommittee, I support their passage today. The Kelsey Smith Act is the most complicated and controversial bill of the three. Ironically, it skipped both subcommittee hearings and markup. As a result, many complex issues such as consumer privacy regarding call location data and due process involving warrantless search and seizure have not been publicly vetted in an open forum guided by experts. Nevertheless, I am pleased the two sides have in the last few days tried to work together to improve the bill. It is not perfect, but progress has been made. The amendment in the nature of the substitute includes new protections to ensure a request made under this bill must be accompanied by a sworn written statement on the probable cause for such an emergency disclosure, and that a court order must be sought within 48 hours after the request is made. Thank you, Mr. Chairman. I look forward to the markup continuing tomorrow. Yield back my time.
Gentleman yields back. Chair would recognize the Chairman of the Health Subcommittee, Mr. Pitts, for an opening statement.
Thank you, Mr. Chairman. I'll focus my remarks on today's four health-related bills. First, we have H.R. 3522, the Employee Health Care Protection Act, introduced by Dr. Cassidy. H.R. 3522 would permanently grandfather all group plans issued by health insurers that were in existence in 2013, allowing consumers to keep the coverage they like and giving small businesses better options than ACA-compliant plans. Secondly, we have H.R. 4701, the Tick-borne Disease Research Accountability and Transparency Act of 2014, introduced by Representative Gibson. H.R. 4701 will help to improve understanding of and treatment for Lyme and tick-borne disease by establishing a working group that will prepare a report for Congress and the Secretary that summarizes current federal activities and identifies the latest scientific advances. That report will then inform an effort by the Secretary of HHS to develop a strategic plan to improve prevention, diagnosis, and treatment of Lyme disease. Third is a bill from Representative Jenkins, H.R. 4067. This bill would continue to delay the enforcement of a 2009 Centers for Medicare and Medicaid Services rule that mandated direct physician supervision of outpatient therapeutic services such as drug infusions, blood transfusions, and cardiac and pulmonary rehabilitation services. And finally, we have H.R. 5214 introduced by Congressman Olson and Sessions to require the Secretary of Health and Human Services to provide for recommendations for the development and use of clinical data registries for the improvement of patient care. I urge all of my colleagues to support these bills, and I yield back the remainder of my time.
Gentleman yields back. The chair would yield 3 minutes for an opening statement to the ranking member of the Health Subcommittee, Mr. Pallone.
Thank you, Mr. Chairman. In the interest of time, I'm going to focus my comments on the 4 health bills under consideration today. Only one of these bills has gone through regular order, and I think I made my views known yesterday when I objected to the subcommittee proceedings. But to quickly recap, regular order is not just a saying. It has meaning and it has purpose. Part of the committee's job, and one that I view as very important, is to thoroughly review policy and make its best recommendations to the full House of Representatives on its implications. That includes having thorough input at all stages of the legislation and value in shaping the bill. The minority or the subcommittee had zero input into the 3 of these bills being considered, and I have yet to hear a good reason for why we must bypass a legitimate legislative process for these bills today. H.R. 4067 would reinstate an expired delay of enforcement at CMS. The policy proposed by CMS would ensure that physician supervision in states that require such supervision is followed. It's clear we have not examined this policy in any way and what implications of an additional delay would mean. Frankly, the likely result of such a bill would be confusion for the hospitals. CMS is currently enforcing this policy. It is already in place and has been for 7 months. It remains unclear to me why an additional delay is needed, and simply telling me that the Senate passed this bill by unanimous consent in February is not sufficient. H.R. 5214, which until late last night was a committee print, would set up a very prescriptive language for the Secretary of HHS to publish detailed recommendations on how to establish registries. Unfortunately, it can't be described as bipartisan or non-controversial. We all agree that registries are a good thing. In fact, they were a big part of the discussion during the SGR process, and we remain committed to our efforts to enact those registry provisions along with the SGR bill. This new bill, however, appears to duplicate current public-private efforts that are already in existence. Both the AMA through the National Quality Registry Network and the Agency for Healthcare Quality Research through its extensive public-private registry user guide have already done exactly what this bill appears to be seeking to do, and that is provide detailed information on how to establish, operate, and use registries for quality improvement and outcomes improvement. So, Mr. Chairman, what we've learned from our work on registries is not that provider organizations don't know how to set up a registry. The real problem is lack of funding. That's why the bipartisan SGR bill included provisions that would incentivize the development and use of registries. There's no reason a committee bill on registries couldn't be bipartisan, but I can't support a bill that adds more bureaucracy and duplicates what's already out there. And then we have H.R. 3352, which is just another political attack on the Affordable Care Act. It would allow insurance companies to discriminate against small businesses if they have older workforce, more women in the workforce, or if any of their employees or children have pre-existing health conditions. Republicans are claiming that this is just an effort to help people keep the coverage they have. But let's be clear, if your insurance starts covering your child to the age of 26, you're not losing your old coverage. Your coverage is simply getting better. If your insurance starts covering preventive services like annual physicals and vaccinations and cancer screening for free, that's not losing your old coverage. That's your coverage getting better. There's no evidence employers are dropping coverage en masse, and so Republicans are left to claim people are losing their coverage when their coverage is actually getting better. And I think that's misleading, and I oppose this bill. And lastly, Mr. Chairman, H.R. 4701, a Vector-Borne Disease Research Accountability Act, still does not have consensus. The goal is to advance research on Lyme disease, ensuring continuation of ongoing Health and Human Services efforts on Lyme disease. But staffs continue to work through our differences, and I'm hopeful that the additional changes we've requested can be made so that I can lend my support to at least one of these health bills today. But we all agree, Mr. Chairman, this committee has proven it's capable of working in a bipartisan way. Under your leadership and that of Ranking Member Waxman, we've got a great track record, and I hate to see it tarnished today by lopsided votes on health bills. I thank you.
Chair, thanks, gentlemen. Now recognize gentleman from Oregon, Mr. Wald.
Thank the Chairman. Today we're marking up three important and bipartisan communications and technology bills. All of these bills aim to better the lives of Americans through the honest and effective use of modern technology. The most meaningful of these efforts that we'll consider today is the Kelsey Smith Act, a bill that creates a tool for law enforcement in times of emergency where a person may be in grave danger. Many of us carry a cell phone with us all the time. This bill allows that device to become a lifesaver when someone needs help most. Under this legislation, carriers are required to provide location data to law enforcement in situations where an officer has probable cause to believe that someone is at risk of serious injury or death. Current law permits carriers to release that information upon request, but strangely requires wireless carrier lawyers pass judgment on and agree with good faith belief of the law enforcement officers in the field before they can provide the information. Now, the provisions of the Kelsey Smith Act take that decision out of the hands of carriers and leave the law enforcement officers that are best suited to understand the facts at hand to determine when emergency circumstances warrant expedience. As the Washington Post editorial pointed out, this law saves lives using existing technology. Doesn't cost the taxpayers a dime. It's very similar to the law that New Jersey already has on the books. Versions of this legislation have been passed in 14 states, and it's time for it to move at the federal level. This is an example of how the technology that we use so often for the day-to-day of our lives, reading email, checking social media, getting the score of games, can be put to a truly important use, a life-saving use, preventing tragedies and helping law enforcement save lives. I'd like to thank my colleague, the gentleman from Kansas, Mr. Yoder, for his tireless work to move this bill and make the Kelsey Smith Act a reality. I also thank the minority for their willingness to work with us to produce the amendment in the nature of a substitute that we will consider at the markup. The amendment represents yet another example of our bipartisan work. It's an indicative of the hard work of the Energy and Commerce Committee and our staffs. Next, the Anti-Spoofing Act of 2013 extends the important protection of the Truth in Caller ID Act of 2009 from voice calls to include text messages and certain voice-over Internet protocol services. Now, as we discussed in last week's legislative hearing, there have been too many instances where bad actors have used technology to mask their identity when contacting unsuspecting recipients. Recipients are tricked into revealing sensitive and personal information to someone they thought was a trusted contact. Congressman Barton and Congresswoman Meng have worked together to produce a bipartisan solution that helps to protect American consumers from fraud on these important communications media, and I'm happy to support the legislation. Finally, the E-Label Act, sponsored by Subcommittee on Communications and Technology Vice Chairman Bob Latta and other members of the subcommittee, modernizes the FCC's equipment labeling rules for the 21st century. Specifically, it permits equipment manufacturers to take advantage of the technology available in the devices they create and display the FCC certification information on the screens of devices, rather than etching it into the device itself. Providing the information through software on the device allows for more extensive, up-to-date information and even cost savings for manufacturers. The FCC's old rules are simply outdated, and they don't have the flexibility that both manufacturers and consumers desire. We spend a great deal of time on our efforts to modernize and streamline the agency and regulations by which it governs this incredibly dynamic and innovative sector, and this is a small but significant step toward that goal. Bipartisan, bicameral legislation is common sense reform that we can all support, and it's my hope that my colleagues will join me in supporting and voting for these three pieces of collaborative bipartisan legislation. I yield back.
Chair, thanks, gentlemen. Now I recognize the gentleman from Texas, Mr. Green, for 3 minutes for an opening statement.
Thank you, Mr. Chairman, for the opportunity to speak. I thought Mr. Kowski was here before me, though, if you want to.
All right, I had her afterwards, but go ahead.
Okay, I'm going to defer to you.
The gentlelady from Illinois, Ms. Shakowski.
Really appreciate that. I thank both gentlemen. Thank you. I support the Anti-Spoofing Act and the E-Label Act, both common sense proposals that will benefit consumers, and I'm also glad that several of my privacy concerns with regard to the Kelsey Smith Act have been addressed, and I plan to support its passage tomorrow as well. But I do want to associate myself with Mr. Waxman's concerns about process. I am growing increasingly concerned that we're having health legislation come before the full committee for markup that has not had a legislative hearing, nor in some cases a subcommittee markup. Legislative hearings and subcommittee markups provide us the opportunity to get input from a wide variety of stakeholders to ensure that we're advancing thoughtful legislation. Failure to do so increasingly makes it difficult to appropriately review legislation being pushed through the committee. For example, the lack of a legislative hearing on H.R. 4067 and the bill to require the Secretary of HHS to provide recommendations for clinical data registries leaves it unclear why both bills are needed and whether the legislation being proposed is the best solution. I could understand perhaps the desire to advance H.R. 4067 before the enforcement of the supervision requirements went into effect, but I don't understand the need to delay the requirements just for the next 5 months after they've already been in effect for 7 months. Similarly, I understand the promise of clinical data registries, but it's unclear that the Secretary needs to advance prescriptive guidelines to spur their development. Maybe both pieces of legislation are needed, but it remains unclear since we did not have the opportunity to have our questions answered through legislative hearings. I strongly oppose H.R. 5322 because it would allow insurance companies to once again be able to discriminate against small businesses with older workers, sicker workers, and women workers. I support efforts to promote scientifically robust medical research into Lyme disease, another one of our bills that spurs the discovery and development of more effective treatment for individuals with this condition. However, I have concern with some of the changes that were made to the version of H.R. 4701 that passed the subcommittee. I hope that we can continue to work together to alleviate those concerns before this bill reaches the floor. And I yield back.
Chair, thanks, gentlelady. Now I recognize the Chair Emeritus of the full committee, Mr. Barton. 3 minutes for an opening statement.
Thank you, Mr. Chairman. I appreciate the opening statement time today, and I appreciate that Chairman Upton at the full committee is going to offer these bills tomorrow. There are a number of health bills and telco bills that will be marked up. On the health bills, H.R. 4067 is important because in Texas there are many small and rural hospitals, and this bill would allow some of the critical access in small rural hospitals to continue to offer some of these therapeutic services. The needs and challenges of the smaller hospitals are often overlooked today, so I'm glad that the committee will be taking up that bill. On the telecommunications side, I'm happy to see that H.R. 3670, the Anti-Spoofing Act of 2014, which is a bipartisan bill, will be voted on tomorrow. Like I mentioned at the subcommittee hearing last week, it's my plan to offer an amendment in the nature of a substitute that would address the concerns of various stakeholders. We have received input from such companies as Microsoft, Google, Vonage, U.S. Telecom, AT&T, and such groups as CTIA and NCTA. We are very happy to receive such input, and I believe that the amended version that I'll introduce tomorrow will go a long way towards making sure that H.R. 3670 continues to have the bipartisanship that it's had at the subcommittee level. With that, Mr. Chairman, I appreciate your courtesy, and I yield back.
Thanks, gentlemen. Now recognize the gentleman from Texas, Mr. Green, 3 minutes for an opening statement.
Thank you, Mr. Chairman, for the opportunity to speak during these opening statements. When we follow the process and put forward thoughtful and openly debated legislative proposals, we uphold the role this committee and the American people benefit. Clinical registries play a critical part in advancing medicine and public safety, and there is a great opportunity for us to work in a bipartisan fashion to further the adoption and use of the robust registries. The American Medical Association scientific experts are concerned about H.R. 5241, will actually be counterproductive to ongoing private and public efforts in this space and could lead to inappropriate overregulation of clinical registries. It's likely that any resulting guidelines would be incorporated into current HHS efforts on quality, leading clinical registry stewards to build around federal requirements rather than the specific needs of the research and the medical community and the patients they serve. I believe the legislation on clinical registries should be passed by this committee with strong bipartisan and stakeholder support, and hope my colleagues will revisit this issue in a thoughtful and deliberate manner. While I support efforts to better coordinate federal activities and research related to Lyme's disease and other tick-borne disease, I'm concerned by the provisions in the substitute amendment on H.R. 4701. Recommendations from federal working groups and scientific advisory panels must be based on best available science. The lessons learned from other therapeutic areas, particularly vaccines, should not be quickly forgotten. H.R. 5322, the so-called Employee Health Care Protection Act, would limit the access to consumer protections, including in the ACA, for many American workers. It's long past time to move beyond efforts to undermine and repeal and sabotage the Affordable Care Act and start working together and improve and build upon the law's initial successes. I urge the Chairman to return to a process that's thoughtful and delivered in the best serves the American people. Anti-Spoofing Act, H.R. 3670, addresses a major consumer protection concern for my constituents. Spoofing or callers deliberately falsifying their caller ID information. Spoofing opens the door to con artists who can defraud and cause harm to unsuspecting phone users. Congress passed legislation in 2010 in order to bring an end to this practice. Today's bill and Mr. Barton's amendment in nature substitute are valuable improvements in the 2010 law, and I intend to voting for it in this bipartisan legislation. Similarly, I'm voting in support of the E-Label Act, H.R. 5161. This bipartisan bill introduced by Representatives Latta, SU, Blackburn, and Welch will ease labeling and regulatory requirements in certain electrical equipment that display the same information digitally, thereby lowering the regulatory burden on the nation's electronic manufacturers while satisfying consumer protection needs. The amendment nature of a substitute being offered by Mr. Walden on the Kelsey Smith Act, H.R. 1575, addresses many of the privacy concerns I had with the underlying legislation. Though I would much prefer this legislation to be considered under regular order and marked up in the Telecom Subcommittee, I'll be voting for the support in the amendment and the legislation, and I yield back my time.
Chair, thanks, gentlemen. I recognize the gentleman from Texas, Mr. Olson, 3 minutes for opening statement.
I thank the Chair for starting this markup today and including my bill, H.R. 5214. My home state of Texas is having a crisis, a diabetes epidemic that must be stopped. News talks about the immigration crisis on our southern border, but there's another crisis on that border, an explosion of diabetes. Diabetes goes beyond Texas. It's a national problem. Currently, 1 in 10 healthcare dollars are spent on diabetes. In Medicare, the numbers are worse. 1 in $3 go to diabetes. The diabetes epidemic must be addressed before it bankrupts an overstretched healthcare system. And that's why I introduced H.R. 1074, the National Diabetes Clinical Care Commission Act. And while the bill we're marking up today is slightly different than H.R. 1074, H.R. 5214 does keep a few key components of H.R. 1074. H.R. 5214 will use the clinical registries to evaluate care methods of managing a disease. H.R. 5214 will also report relevant data so that new therapies, like an artificial pancreas, can be covered. The data from these registries can be used to create best practices, new tools, and educational resources. It requires the Secretary of Health and Human Services to integrate clinical practice guidelines or standards of care to improve patient care. It ensures that HHS consult with clinical experts to develop strong, unified recommendations. I am thankful for both Chairman Upton and his staff and Chairman Pitts and his staff, the diabetes groups, and especially the American Association of Clinical Endocrinologists for all their help with H.R. 5214. I urge support of this bill and yield back.
Chair, thanks, gentlemen. Now recognize the gentleman from Virginia, Mr. Griffith, 3 minutes for an opening statement.
Thank you, Mr. Chairman. I appreciate this opportunity. I'm here today to speak on H.R. 4701, the Tick-borne Disease Research Accountability and Transparency Act of 2014. I would like to note that my good friend and fellow Virginian, Representative Frank Wolf, is one of the champions of this legislation and has worked tirelessly to raise the issue of Lyme disease as it continues to grow as a problem in Northern Virginia and all across our great Commonwealth. It also gives me an opportunity, Mr. Chairman, to speak on a matter which may seem to be small, appear to be small, but it is a step out of the wilderness for the legislative branch, the People's House, a wilderness that we in Congress over the course of the last 50 or 60 years have willingly wandered into. And while it may appear to be small, I would submit before I go into it that little things mean a lot and that process does matter. I would note that this bill, H.R. 4701, creates a new federal working group. I support these working groups and advisory committees. But these working groups offer us in the People's House an opportunity to reestablish just a little bit of the influence of the legislative branch in our federal government. For too long, Congress has yielded too much power over appointments to the executive branch, and I think it's time that we defend the prerogatives of the legislative branch. To do so, we must first change the culture in Washington, even in small ways, by allowing Congress to control some of the non-governmental appointments to working groups and advisory boards such as this one. Now, I would advocate that it should be a majority of those people, but that may be for another day. If the legislature gets to appoint more members, then when policy suggestions are made, the members will be more likely to involve the legislative branch of government and not just represent the position of the executive branch. Now, I'm a legislator by nature. It's what I have always done. It's what I was called to do. And preserving the powers of the legislative branch, that branch of government closest to the people, is extremely important to me and has always been important to me. I served for 17 years in the Virginia State Legislature. I never thought about running for governor or any other executive office because I'm a legislator. And defending our prerogatives of the legislative branch are extremely important. And if you don't believe me, just ask the governors that I served with, whether it was Governor Gilmore or later Senator Allen, but governor at the time, or current Senators Warner and Kane. Now, as a part of this process, Mr. Chairman, I have asked my staff to draft possible amendments for this bill to have even more legislative appointments because we must begin the process of standing up for the institution of the United States Congress as the People's House by reasserting our legislative powers over the executive branch and not having unelected appointed officials selecting all these folks who are going to serve on these boards. With that said, Mr. Chairman, I appreciate your indulgence and your time, and I yield back.
Chair, thanks, gentlemen, and now yields 3 minutes to the gentleman from Georgia, Dr. Gingrich.
Thank you, Mr. Chairman. And I want to thank you for calling today's markup on 7 important pieces of legislation from both the Health and Communication Technology subcommittees. As a member of the Health Subcommittee and former member of the Communication Technology Subcommittee, all of the bills that we have before us address critical issues within those industries. Since my time is short, I'm going to focus my remarks on H.R. 3522, the Employee Health Care Protection Act. Before this committee even held its markup of the House version of the Affordable Care Act, President Obama made his first of many assurance to the American people in June of 2009 that, and I quote, "If you like your health care plan, you'll be able to keep your health care plan, period. No one will take it away, no matter what." End of quote. Unfortunately, Mr. Chairman, we have seen this to be nothing more than an empty promise that the President repeated on numerous occasions. Since the enactment of the health care law, millions of Americans have been notified that their insurance plans have been canceled. Yesterday's Health Subcommittee hearing was designed to examine this issue, and that is precisely why we need to pass H.R. 3522. This common sense legislation would simply allow health insurance issuers to continue to offer group coverage that was in effect in 2013. And I commend our colleague from Louisiana, Dr. Cassidy, for his leadership on this legislation. If the President will not keep his promise to the American people that, quote again, if you like your health care plan, you'll be able to keep your health care plan, then we need to do it for him. H.R. 3522 will help us accomplish that goal. Mr. Chairman, I ask all my colleagues to support this important legislation as well as the other bills included in this markup. And I yield back the balance of my time.
Chair, thanks, gentlemen. Now recognize the gentleman from Ohio, Mr. Latta, 3 minutes for an opening statement.
Well, thank you very much, Mr. Chairman, and thank you for holding today's markup. The E-Label Act that I introduced is a bipartisan, bicameral proposal that marks a step forward in our efforts to modernize laws for the digital communications age. This measure streamlines the electronic device manufacturing process by allowing manufacturers of devices with screens like smartphones and tablets to display an electronic or digital label instead of a physical label to certify compliance with the FCC's equipment authorization standard. By permitting e-labeling, it can help save tens of millions of dollars for manufacturers and can enhance consumer welfare by expanding the access and availability of relevant device information. The E-Label Act complements the FCC's recent guidance on this issue by establishing a time frame for moving with a rulemaking. This will ensure that the Commission takes timely action on this issue and resolves any uncertainty that manufacturers might have in opting to use e-labels. I thank Congressman Welsh, Congresswoman Blackburn, and Ranking Member Eshoo for their support on this measure. I urge my colleagues to support this legislation, and Mr. Chairman, I yield back the balance of my time.
Chair, thanks to the gentleman. That concludes the opening statements. Chair calls up H.R. 3670 and asks the clerk to report.
H.R. 3670 to amend the Communications Act of 1934 to expand and clarify the prohibition on provision.
Objection, the first reading of the bill is dispensed with. The bill will be open for amendment at any point. So ordered. For information of members, we are now on H.R. 3670. The committee will reconvene tomorrow at 10 a.m., and I remind members that the chair will give priority recognition to amendments offered on a bipartisan basis. I look forward to seeing all of you tomorrow. Without objection, the committee stands in recess.